50 KTRS, Doug McKelvin in for McGraw Millhaven. Dr. Nirav Patel, who's Chief Medical Officer at SSM Health, St. Louis University Hospital, joins us now. Doctor, good morning, and thanks for carving some time out of your busy Monday morning to join us.
Good morning. No problem. Thank you.
You know, I wanted to get in touch with somebody who knows a lot more about this than I do. When I tumbled across, actually, my sister sent me this story because she lives over in the Virginia Beach area where this thing started to break at the Eastern Virginia Medical School. And it's a physician who said, you know, we've had people come into the hospital and they have sepsis, which is a terrible, terrible thing. Basically, your body is shutting down, and I'll get you to give us a professional explanation of what it is, but you get very, very sick, and your chances of living aren't very good. Well, he tumbled on it thinking, well, what if I use a combination of vitamin C and some other antibiotics? And he claims he's got a woman, as of about a year ago, who was at death's door, ICU, bad shape, treated her, and she was out of ICU in 2 days and now is home and living a good life. I'm a bit of a skeptic here, and I am because vitamin C has been the be-all to end-all over the years for any number of things, and I wanted to get a professional in here. I guess, first of all, sepsis. What exactly is sepsis, and why should we be so terribly concerned about it?
Well, good question. Sepsis is a overwhelming infection. It can start in different places. You can get sepsis from pneumonia. You can get sepsis from a urinary tract infection. You can get sepsis from a whole host of infections. And what it amounts to is basically infection has progressed to a point where it's overwhelming your body. Your body ends up mounting an over-the-top response because infection is so bad. But that response itself ends up hurting you as well. And so it's a cascade of events in your body that leads to the things you talk about, which is organ shutdown, different organs stop working, you're not getting good blood flow to places, and it can result in death of the patient.
Now, this is a Dr. Merrick Fowler is his name, and he's the one who basically got tumbled onto this whole thing. And I guess they're undergoing, I don't think, you can't call them clinical trials, but at least they're trialing to see what this does. Is this the be-all to end-all, or are we just looking at a series of events where patients come in, they have sepsis, and they just got incredibly lucky with the combination of the antibiotics and the vitamin C, and that's why they have survived?
Well, I as you mentioned, I think that this is vitamin C has been in the news for decades as a supposed magical cure for things, and I am also a skeptic. So I will say that I'm fairly skeptical of the results in this study that Dr. Merrick conducted. They used it was a single center and basically him doing it by himself. So yeah, that's already a concern. But essentially, they used vitamin C, some steroids, and thiamine, vitamin B1, and gave it at a fairly high dose. And then the purported claim is that sepsis was treated in a number of patients that wouldn't have been expected to have survived from their sepsis. I'm always skeptical of these types of quote-unquote studies because it's one doc working at one hospital who they even in the paper that they mentioned they had 3 patients that they started off with that were the what they call the index cases where they tried it out on, and it worked, and so then they got excited. And to me, this is always very scary from a science perspective because I have a lot of hope, and I'm an ICU doctor. I work with patients all the time, and I really want to get them better, and I'm hopeful that I can give them some treatment that's going to work. But what they've done is they've basically taken that hope and then put it into the form of a vitamin C capsule or an injection in this case. And I'm not really sure that that's really related. Yes, the medications were given, and yes, some patients got better, but I'm not sure they're related to the medication. I think that here's a gentleman who's working very closely with very sick patients. Sometimes just the attention to those patients can be enough to get them better, right? You're sitting in the ICU every 5 minutes. You're making small changes. That can make a difference. The attention of a good doctor can make a big difference in these types of patients. And so I think that what's needed, if you really want to answer this question, is a bigger study. They only use 47 patients here, which is really small from a medical study perspective. You'd want to use a larger study, and you want to do it at different hospitals, and you want to do it with different physicians and in a protocolized manner. So that way you can say, okay, everyone's getting the same regular treatment for sepsis, the same basic antibiotics, maybe even the same steroid mix, because steroids have been used for sepsis in the past, and sometimes they seem to work as well. And then you say, okay, well, is it vitamin C or is it not? And then you do that, and you do that in a blinded fashion, meaning that nobody knows what treatment any of the patients are getting. So you're not injecting any level of bias or some prejudice into the study. And I think that that's the biggest concern I have, is that they assume that the vitamin C worked, and then as soon as they made that assumption, they're like, okay, let's check it out, and then they validated that. But they had already pre-decided, in my mind, the outcome.
Very good. Doctor, thanks for sharing some time with us this morning. And I guess this is one of those to be continued type of things. But I appreciate the time this morning.
Absolutely. Thanks for having me.
Dr. Nirav Patel, Chief Medical Officer at SSM Health, joining us this morning. We'll get a traffic and weather update in just a minute. 7:11 now here on the